Well, welcome back to the show, Shelbourn. It's such a pleasure to have you here.
Thank you.
Now, for some of our viewers who may not have seen you on the show before or who haven't met you previously, tell us a little bit about your role at the hospital.
Well, I've been the president now for 11 months, soon to be a year. It's flown by.
Gonna have an anniversary.
Yeah, I've been with Brunswick for 7 years, and so I've had a variety of roles, but it's been an exciting year this past year as the president.
I'm sure it has. I'd like to hear a little bit more about your education and your background. I know you've got a very varied background. You've done several things, so let's share that with our viewers.
I've been in healthcare for a little over 23 years. Wow. Started out as a respiratory therapist years ago and did clinical work for 10 or 12 years, and then got into leadership. I have a bachelor's in business from High Point University and an MBA from Gardner-Webb.
Excellent, excellent. And so now you've switched from the clinical side to the administrative side, but I bet your clinical background really helps with the administrative side.
It does help. Having that experience at the bedside really comes in handy as an administrator.
Well, good. Now, I know our main focus today is to talk about the new medical office building that I see has opened up next to the brand new Brunswick Novant Medical Center. When did that building open?
We opened it last December.
Last December. Well, what practices are currently housed there?
Currently there are two, Brunswick Women's Center and Brunswick Surgical Associates are housed there.
And those are both Novant Medical Group practices, is that correct?
They are part of the medical group.
Well, are there any plans in the works to add other practices to that space?
We are. We're just getting ready to start construction now for 3 more practices going in there. Brunswick Urological Associates will be going in there. Then we're going to have a primary care office space, and then Cape Fear Heart is going in there.
Cape Fear Heart, that's awesome. Right next to the hospital, that would be so convenient for the physicians.
It is. It's so good having them right next to the hospital. The proximity works well for both patients and physicians. It's easy for the physicians to come to the hospital to see their patients or perform surgery in the morning and go see patients right after surgery in the building next door.
Yeah, I bet it is particularly convenient for surgeons, and I was really thinking about the OBs when they have to deliver a baby. It's just so close to run across the street.
It is. It's working out really, really well.
You don't even have to get in the car anymore.
No.
That's great. Well, I know I attended the open house for the medical office building back in December, and the offices were very spacious and they were beautifully appointed and very, very nice, but they were also a little different from one another. And is there a reason why the layouts are different?
There is. We highly involve the physicians in the layout of their new practices, and we make them unique to fit their practice. So Brunswick Surgical Associates had input into the design of theirs to meet their surgical patient needs, and Brunswick Women's had input on the design of theirs for their expectant moms or other women that are coming there, and also for growth. As their services grow, we may add more providers to those clinics, and we need to go ahead and build that additional space now. So
the new spaces that you're planning, those physicians will more than likely be involved if they're already...
They've already been highly involved with the layout.
They've already been. Well, great. I'm sure they're happy about that. Well, tell me, what was the main reason that Novant decided to build the medical office building on the Brunswick Novant Medical Center campus?
Again, it's the proximity and the convenience for both physicians and for patients. For the physicians, they can go back and forth easily, like you said, without having to get into a car. And for the patients, they could see the physician. If the physician thinks they need outpatient imaging testing or something, most of the time that can be scheduled that same day or the next day, and it's just convenient for the patients right there.
Are there plans to expand that building in any way or additional buildings on the campus?
As the need arises or as we hire more physicians in or more specialists come to the area, we will expand that existing building, or we'll look at the option of just building a new building next to that one.
I imagine that you've had really great response from the community and the patients about that new building. Is that the case?
It is. They really like coming onto the hospital campus and having everything right there convenient for them.
Well, I hear the food at the hospital is great. So maybe they even have lunch while they're there.
A few do. A lot of community members stop by there for lunch from time to time.
Well, I know I heard the other day that cardiac rehabilitation and physical therapy also moved from their old space at the old hospital up to the new facility. Is that correct?
That is correct. We have moved them into the hospital main building there. Physical therapy is located on the first floor, and then outpatient cardiac rehab and pulmonary rehab are located on the ground floor.
On the ground floor. And I'm sure there's signage and all that. So.
There is.
Okay. Well, that's really good to hear. I'm happy that the feedback has been very positive about the new building there. But while I've got you here, I hear about this new service being offered, provided by Brunswick Novant Medical Center, and it's called the Care Now. Talk to me about that. And
we're very excited about Care Now, and this is really a service that we're providing. It gives patients access to a registered nurse 24 hours a day, 7 days a week. So if they have a question or they have an illness that they're not sure what to do, they can call this number and the nurse will help direct them to the appropriate care.
so it's kind of like the call before you call the doctor, maybe, or before you
Exactly.
call the ER. You could call this nurse and talk to them about. And then they could better direct you, perhaps?
They can. They will listen to what's going on with you, and if you need immediate care, they'll direct you to the emergency department, or they'll direct you to convenient care, or they'll direct you to follow up with your primary care physician. If you don't have one, they have a list of all of our primary care
really?
physicians in the area. They can direct you to one of those, and in some cases, they have access to go ahead and schedule an appointment for you for some of the physicians.
Well, that sounds like a great resource for the community. And is there a specific phone number to call?
Yes, any patients out in the community can call 910-721-CARE or 910-721-2273.
2273. How about, can you give us an example of when it might be appropriate to call Care Now?
Sure. A good example is a parent picks up their child from a neighbor's house who's been keeping them, and they had something for dinner, and the parent's not sure if they're breaking out in a rash or having an allergic reaction and just have a question and uncertain. This is a perfect example to call that number, speak to the nurse, talk to them about the signs and symptoms. They'll ask you specific questions, and they'll help you determine, does the child need to be seen at the emergency department or go to convenient care, or what needs to be done for them. Or it could be your child just gets sick and starts running a really high fever in the night and you're not sure what to do with your sick child. They can help get you to the appropriate care that you need.
And so it's 24/7. You can call any time of day or night.
24/7, any patient in the community can call with any question that they have.
That's great. I love that resource. I
It
may
is
have
awesome.
to use that myself. I also heard about the MyChart, and I'm not clear about what that is. Can you talk to me a little bit about that?
Yeah, MyChart is part of our medical group offices, and it's a patient portal. Basically, it's an online way that you can communicate with the physician and also as office. And I use MyChart as a patient myself.
Really?
So it was easy recently for me to go on and request an appointment for my annual well visit. They automatically sent me back some options of dates, and I just replied back in the email of which date and time worked for me, and it was actually in that same week. And then when I went to the physician, had lab work and stuff drawn, all of that was available to me online to look at, and he was letting me know about my results and what he wanted me to do about certain blood tests right there online. And we were able to chat back and forth, and I was also able to get prescription refills just by sending an email back to the provider.
You can email your provider,
You sure can. So
and they respond?
they do.
Wow.
They do.
That's great.
It's really, really great. I love it. Do it from convenience at home anytime.
Wow, I like that. In order to have MyChart, you would have to have a Novant Medical Group physician?
Right now in this market, it's mostly the medical group physicians, but other physicians could also have access eventually to MyChart.
Wow, I think that's a great resource too. I
It's an excellent resource.
look forward to seeing that grow throughout the marketplace. Well, before I let you go today, Shelbourn, is there anything else that you would like to share with our viewers?
Sure, June. We're just really excited about everyone using the new facility. We'd really like to hear from the patients and their families about their experience. If they have any ideas for opportunities for us to improve services, we'd really love to hear from them about that. And I'm really excited about the growth we've seen in the last year. You can drive by there every day and the parking lot is full. We've seen a lot of growth in different service areas, and it's just a really exciting time.
I have noticed that the parking lot, I pass by there several times a day, and I have noticed that the parking lot is extremely full. And I'm curious, what do you attribute the growth to?
Well, a lot of folks are using our emergency department now versus driving elsewhere. We've seen a lot of growth around surgical services with the addition of orthopedic surgeons, the addition of the spine program with Dr. Foster. I think he's been on your show before as well.
You're right.
And then the Da Vinci program that we've started, and I think they're going to be on your show as well.
They're our next guest, as a matter of fact. Dr. Wu and Kenya will be here talking about the Da Vinci system. So. All of that, I guess. But you know what? I thought of one. How about the MRI? I saw this picture of it, and it's this huge thing with this big opening.
It is. It's a large bore MRI, which means the opening is much larger. A lot of people used to tell us they felt like they were in a coffin in an MRI. They used to be very small and tight. Now this one is much larger, similar to a CT scanner. And so people are more comfortable. They don't need sedation to have their MRI done. So you're exactly right. A lot of folks are coming to us for that MRI and our other imaging. We have all new technology in the imaging department. So the physicians are really referring their patients up to the hospital.
Getting back to the MRI, so people, if they tend to be claustrophobic, it's probably a lot easier for them. Is that right?
It is. We can scan the lower part of your body, and so your head is sticking out, and you can see the ceiling. And we also have a window in that room as well, so there's some natural sunlight coming in there. And patients often come out and comment how this was much more relaxing this time. They weren't nervous at all. So it's really a great experience for them.
Well, good. Yes, there are many reasons why then the growth is there.
Yeah, it's very exciting times.
Yeah, that's wonderful. It's wonderful for the folks of Brunswick County. They no longer have to go outside Brunswick County to get great, excellent care.
Absolutely.
Well, thanks again for being here. It's been a pleasure to have you back, and I look forward to the next time you're here, and we'll talk about something else that's exciting.
It's great to be here.
Thank you.